Okay, we have a similar case of an open bite. You can see there is space. Okay, there is space between the upper and the lower, although on the glass slab the setting is perfect. Okay. We also have the pin not touching the table. See, there is a space between the pin and the table. There is an open bite, and then there is a touch posteriorly. In the previous video, we explained why it happens. Okay, that we are squeezing on the teeth while still the wax is soft on the glass slab and not returning to the articulator. We said we have to return to the articulator to make sure our teeth are in position. The student was asking me, what is the solution? Let me talk about the solution first. Okay. What is preventing this articulator to go down? Tooth number 7. Okay? Tooth number 7. So the solution begins by, first of all, removing tooth number 7. Okay? Can you have a lacron or wax that, please? So first of all, I remove tooth number 7 as a solution. Okay? And I go back and check my contact, and I should remove. No, it's okay. It's in contact. If it's not in contact yet, I'm going to remove tooth number 6 if it's not in contact. But it is in contact now. Okay, so the high tooth was removed. The second solution is to watch the setting of the teeth. Now, wherever we have a space, this is a space, I'm going to take down the central incisors first to be close to the lower. So we have the lower wax rim and we have the upper teeth. So we had an open bite. So what do? I bring my lower teeth, still preserving the overjet, but close to the lower teeth. Okay? Until the upper almost are meeting the lower, but with an overjet. So I put down the teeth, the two centrals. Okay? I put down the canine. Now what I'll have then, I'll then have a new plane. Okay? Because the centrals are down, the canine is down, and the 6 is there. So I will have regained my occlusal plane. I regained my occlusal plane. Then, once it is on the glass correct, the centrals and the canine and the 6, and on the wax it's correct on the articulator, I begin adjusting the lateral incisor and the premolars. Okay? And then I put back the curve of Sui into tooth number 6, and I add the curve of Sui in tooth number 7. Okay? A second question I was asked is the following. For some of the students, while setting tooth number 7, okay, they had the tooth touching and interfered with by the base plate, the lower base plate. Okay? Tooth number 7, for some of you, is touching the base plate and has an interference with the base plate. What is the solution for this case? First of all, we're going to increase the curve of Sui. Make sure that we have a curve of Sui. Okay? We're talking about a regular patient with bone relation class 1. We're not talking about class 3 patients. In class 3 patients, bone relation, we have this problem often, or if the tuberosity is large. But anyway, if you want to do a curve of Sui and the tooth is not going in, I'm going to tell you the sequence for putting the tooth into place. So suppose this tooth is high. The first thing I should do when I have a high tooth is first remove the wax. Okay? Remove from the wax and see my position of the tooth. Is it sufficient or not? If it's not sufficient after all the wax is removed, okay, I begin trimming from the base plate. If also the space is not sufficient, I begin trimming from the tooth. The part of the tooth which I trim by is only the fitting surface of the tooth. So it's on the fitting surface where I just take from the fitting surface and I don't touch the labial surface of the tooth because I want to preserve the view from the buccal side. Okay, if I'm going to do the trimming, I do it from the fitting surface, palatally, and below the tooth. Once I come to the labial, I reduce my removal from the tooth. So once more, the sequence of trimming, if I need, and I don't have a space for one tooth, is, first of all, removal of wax. Second, trimming from the base plate. Finally, trimming from the fitting surface of the tooth, while preserving the buccal surface of the tooth totally. Okay? Thank you.